we're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for health system CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together, we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Welcome back to the Health System CXO podcast. Our guest for today is Mikelle Moore. Mikelle Moore has over 25 years of experience in health system provider and payer operations, population health, health equity, social determinants of health, impact investing, and ESG. She's an early pioneer in population health care models and the use of anchor institutions' assets to address social determinants of health. Following her most recent role as the Chief Community Health Officer at Intermountain Health, Mikelle founded Multiplier Advisors alongside Colby Daly as the first impact consultant uniquely founded to support health-focused investors in the United States. Mikelle, thanks for joining me on the Health System CXO podcast.
I'm happy to be here, Jasmine. Thanks for having me.
So we've known each other for several years, starting with your previous role at Intermountain Health and as one of the founding members of the Health Equity Alliance. As we go through the conversation today, I'm excited to hear more about your journey as a healthcare executive, the tidbits that you would share with our listening audience on effective leadership, and what you're up to today at Multiplier Advisors. So I'll start with a little bit of reflection on your career. As you think about your time as a health system executive, what perspective would you share with those who are in leadership roles today?
Well, I would first share this, that healthcare is hard right now in our country. And maybe it's always been hard. It's been a service-oriented mission that tugs at our hearts and souls all the time. Everyone I know in healthcare gives their all and cares so much about making it better. And I think we have to learn as executives and leaders in healthcare to take care of ourselves and to look out for those who are involved in this important work to ensure that as we design and as we redesign this health system that so badly needs it, that we are thinking about equity. We're thinking about really improving health outcomes, and that almost always can begin with our own caregivers and the people that are involved in this work. So that's the perspective I have uniquely today at where I sit right now.
I love that. And I'm sure that's been, hard earned over your many years in healthcare leadership. Are there experiences or successes that you would say you're most proud of?
Well, any success I have ever had has always been through building collaborations, finding shared visions and meaningful outcomes. So that by nature, it means that it's been teams. It's been internal, external, cross-functional teams where any success that I'm proud of comes from. And for me, my career has always been about looking for more systemic solutions to solving the problems that we're facing in healthcare. And I was really proud of leading the flagship hospital at Intermountain and leading it through the transition to a community hospital, which served a very large population of people experiencing homelessness and who were marginalized in some way. And I progressively sought to address those systematic barriers that those people faced and moved on to leadership roles that allowed me to redesign the system's community benefit function and charity care policies and the population health strategy, and eventually the health equity strategy and developing an anchor mission, all kind of rooted in that idea of how do we address the systemic changes that are necessary in order to make the individual care delivery our talented healthcare providers aim to deliver and do deliver so well, but often don't produce the results that we expect in our country.
Right. Yeah. And I know you've pushed so many of the leaders that are in the Alliance and folks that are in your network really thinking, how do we start to invest upstream? And I know that's one of the things that we want to talk a bit more about. So certainly a lot of that is so foundational, I think, to some of the challenges and the priorities that folks are navigating today. Is there anything you would say with the benefit of hindsight that you would approach differently as you think about some of your leadership decisions?
Well, first of all, I think there are so many things that I rethought along the way and changed direction on. And and so I'd say to leaders out there, don't be afraid to admit that you haven't done something correctly and redirect. I'd say one of the things, though, since this is within the context of the way we know each other through the Health Equity Alliance, I think one of the things I'm reflecting a lot on right now is the decision that I made as a leader at Intermountain, and a leader many of us made across the health ecosystem to take advantage of, if you will, the opportunity that COVID presented and then the unfortunate murder of George Floyd, to really grab that opportunity for embedding health equity by pursuing it as a cause in and of itself. Whereas the truth of health and the pursuit of health has always in part been about reducing variation, looking for those quality improvement opportunities, and thinking about more broadly. We had the opportunity, I think, to define health equity in terms that health systems understood and could come at another way. And I wonder, I don't know if it's a decision I regret, but I can remember when we first decided to make health equity its own pillar at Intermountain, what I first recommended was that we not do that, and that instead we embed equity in every pillar we already had as foundational in the system, so that you applied an equity lens to every decision. And we felt overwhelmed by that. And I understood it. And I wished that I hadn't. I think it would have been better to pursue that strategy at the outset. And we would be here in healthcare. Had we would have done more, frankly, if we applied the health equity lens to everything instead of inadvertently making it its own thing. I don't think that was our intent.
Yeah. And I know the complexity of health system operations and really thinking about how you practically apply that lens to work that is happening across the system, how you bring executive leaders along for the journey. You know, a lot of folks are really navigating their own personal learning curves at the same time as they're leading, you know, the workforce alongside the executive team. And so I think a lot of that, now that we're 3 or 4 years into some of these conversations, folks are really having the chance to reflect and think about what worked well and what are some of those decisions that we made that have helped us make some progress. And then what are the things that we might approach differently now, knowing what we know a few years in.
Yeah, absolutely. It's a journey.
So let's talk It's a journey. It's a journey. Absolutely. So I'd love to talk a little bit about impact investing and how you see that in today's healthcare ecosystem. First, I'd love to hear from you. What do you think is working well?
Well, first, I think just to level set. So what I believe impact investing is really that opportunity to create both a financial return alongside measurable health and social or environmental impacts. And so in the context of nonprofit health systems, I think that means aligning investable assets so that they can deliver both financial return and a measurable return that's aligned with the strategy of the organization overall. And when I think about what's working, I love seeing the curiosity healthcare has for the anchor mission and the idea of thinking about the way it invests as a part of a health strategy. And that's evidenced by now 80 systems who have expressed curiosity by joining the Healthcare Anchor Network, and others who are going about it without that participation. But I love the curiosity we have in healthcare to be excellent, to pursue new ways of doing things. I'm also encouraged by the external inspiration that exists out there. The banking industry's redesign of CRAs, which is coming through this next year. The public dollars we've seen aligned towards these strategies right alongside healthcare investors or others in some markets. And, and maybe, to take a negative and turn it into a positive, I think even the questioning of what is the value of the tax exemption in nonprofit healthcare, and how can health systems really better demonstrate their impact on the health community? I think those ingredients are things that set us up well for what needs to happen going forward.
Yeah. Yeah. And I know that's been such a topic of conversation, of really thinking about how do we, meet our mission as institutions that are often the largest employers in our states and our regions, as not-for-profit health systems, as folks that have, organizations that have tremendous influence in their communities. How do you think about that both practically in terms of where there are opportunities to invest, but also the responsibility that comes along with really playing that role, I think, for your local communities and ultimately for the country? Are there places that you would like to see more progress as we head into 2025?
Well, we could have a whole podcast about that, probably.
I'm sure.
But, the first thing I guess I see is the opportunity for alignment. I think as wonderful as that 80 health systems aligning as participants in the Healthcare Anchor Network has been, I think it's very rare for a health system to say, here's how I'm going to take an impact investing strategy or a diverse hiring strategy or any strategy and fully align it with the population health goals that they have as a health system. And we still are very siloed within our own systems around how we're structuring our strategies. And so I'd love to see health systems really focus on internal alignment, step into their potential to be a community convener and catalyst for health improvement that's shared between the health system, government, and other potential investors, and to be willing to be thought leaders in this space as well. I'd also love to see health systems do more health impact investing. There's really very little of it. Even just 1%, which is a rounding error on the balance sheets that health systems have, can have tremendous impact, because it not only represents a sizable impact when you look at investments in local communities, but it usually catalyzes other investors. And so that $1 becomes $10. And that's really outsized impact compared to grant dollars, because they're recycled and reused. So that's what I'd love to see get started. And I think most health systems can afford to start in some small, specific investments in high areas of alignment.
That's great. Some good nuggets for folks to be thinking about as we're heading into the next calendar year. So let's transition to talk more about Multiplier Advisors. I'd love for you to share what role Multiplier Advisors aims to play in advancing health equity as a starting point.
Well, thank you. Multiplier Advisors, the name is important to us because we want to see our work have a multiplying effect. Our intent, we are a partner to health investors in aligning their assets to impact measurable health outcomes. That's our objective. And we recognize that nonprofit health systems, as those investors, are in a time of very scarce resources. And we want to be seen as their partner to ensuring they're thinking beyond the clinical care they're providing to first do no harm and to truly move beyond that to improve health for all people in their communities, and ensuring that they're not doing any harm through their other practices, but thinking about, well, beyond that, how could they have a truly positive impact? The health ecosystem is consolidating, and it's continuing to need population health, yet strained to meet those short-term demands of operating in a strained economic environment in an unattainable or an unsustainable fee-for-service system. So Multiplier is that partner to think about how to utilize these assets in a multiplying way so they're doing double duty. How do your investments also help you with your population health goals, for example?
And are there places, as you've, begun this work, are there places that you're seeing the greatest needs as you look across the healthcare landscape?
Well, yes, I think since most systems now are doing, are providing screens for their patients for social needs, we're learning, and at Intermountain, we were doing that years and years ago, and the needs haven't significantly changed. People have need for immediate things like food and transportation and housing, and those translate to really longer term needs for sustained housing and good jobs. So when we look at where are those investable opportunities where health systems are finding good traction, housing associated with those healthcare needs that they've identified, or health-related social needs they've identified, is the most critical and investable.
Wonderful. Are there bright spots that you might highlight as you think about organizations or perhaps individuals that you've seen moving the needle as it relates to healthcare disparities?
Definitely. We're seeing some regional systems who are really closing the gap on specific health disparities where they've aligned their clinical processes with strong community partnerships and opening up access in non-traditional ways, typically through partnerships or even investments by lending to expand capacity for under-resourced services. And those developments have led systems to then say, well, what other disparities can we solve for? And think beyond those clinical disparities. I think given that systems are now screening for social needs, as I just mentioned, we're also seeing that the investments they've made in healthcare or in housing are becoming sustainable financially. And they're beginning to think about, well, then how do we connect those investments we're making in housing? They might not be bringing the same return that we see in the rest of our investment portfolio, but at least they're returning the capital. Mm-hmm. So how do we now accomplish both a population health aim for some specific populations we care about and get that return on our capital investment, and are seeing the opportunity to invest in housing for their own employees or in specific populations who need immediate housing referrals from the health system. And I think those present both bright spots for where we are today, but a beacon for where health systems can think about going if they're just getting started or looking to refine their activities.
Yeah, I think the fascinating thing about so many of these conversations is it's uncharted territory. There's no established playbook. There's no kind of predetermined outcome. I think that those of us who are hoping to see progress in many of these areas, have seen before. And so really thinking about the creativity and the commitment that it requires to see these investments through, and then what that opens up in terms of, new opportunities or new partnerships that can be created as a result of that work.
Yes, I hope that Multiplier advisors can be a resource in that, recognizing the tumult that healthcare is in. We're hoping we can bring some of that clarity and scaling to an opportunity that's sometimes hard for health systems to embrace because of all the many things on their plates.
Well, I'll wrap us up with one last question. So as you think about many of the things that we talked about today, I think the theme is really getting creative and really, thinking about what's possible with some of these new approaches to healthcare and investing in social determinants of health. What leadership skills would you say that you view as most critical to advancing health equity in healthcare organizations today?
Well, I'll start with transparency. I think that you ask about leadership, and I think of that as individual in some cases. I think being a transparent leader where we talk frankly about the why behind our vision and the challenges that we face in achieving it really helps us to engage everyone in problem solving. And I think as health systems, we need to become more transparent about the health disparities that we are a part of creating and create more transparency around all aspects of our business functions. Not because there's a regulatory requirement. In fact, I don't necessarily feel that those should come from regulatory places, but rather from a spirit of pursuing quality improvement and in pursuit of best practice. And that gets to the second one, which is always do the right thing. I have a mentor who says, always do the right thing, because usually doing the right thing is also the right business decision, at least if you have a long-term view. And as nonprofit healthcare leaders, we should have a long-term view. Our communities need it from us. These health outcomes are decades in the making, generations in the making, and we should find a way to do the right thing with that long view. Third, I think finding the win-win, the shared goal identification process, both internally and externally, yields great results. And I can think of no place where it's more needed than in health equity. We have to find the opportunity to meet our business objectives and deliver quality outcomes, and there's no trade-off required. And then lastly, inclusive leadership. We need to seek solutions from those that are closest to the problem. So one of the things I learned early as a baby hospital administrator was go to the people who are cleaning the bathrooms in your patient rooms to understand how to improve efficiency in the staffing model. We need to follow that same basic core leadership principle when tackling really complex systemic problems.
Perfect insights. Well, Mikelle, thank you so much for your leadership, for your generosity, for your expertise. And it was a treat to have you on the Health System CXO podcast.
Thank you, Jasmine. My pleasure. And thank you for all you do to advance health in our communities.
Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.